Hello and welcome. My name is Dr. Deborah Pinels. I serve as a forensic consultant for SMI Advisor. Additionally, I serve as the director of the program in psychiatry, law, and ethics, and as an adjunct clinical professor of psychiatry at the University of Michigan Medical School, and senior medical and forensic advisor for the National Association of State Mental Health Program Directors. I'm board certified in psychiatry and forensic psychiatry and a diplomate of the American Board of Addiction Medicine, and have spent much of my career working across correctional and public mental health systems. I'd like to introduce you today to two of my colleagues, Dr. Kathryn Hall and Dr. Charletta Dennis. They will be sharing the lessons they have learned around providing basic treatments to those with serious mental illness, or SMI, in correctional settings. Dr. Hall is board certified in psychiatry with added qualifications in forensic psychiatry. She has provided care in various prison systems throughout her 30-year career, including 2 women's-only prisons, MCI Framingham in Massachusetts and Washington Correctional Center for Women in Gig Harbor. Dr. Hall's main expertise is in forensic and carceral psychiatry and the treatment of psychological trauma. Dr. Charletta Dennis is board certified in psychiatry and forensic psychiatry and certified in correctional healthcare. She completed a forensic psychiatry fellowship at the University of Michigan Medical School and has treated patients in a variety of settings, including residential care, inpatient and outpatient treatment settings, partial hospitalization programs, and prisons. Dr. Dennis has several years' experience in utilization management, conducting peer reviews to determine the appropriate levels of care for patients. Thank you both for taking the time to discuss your experience working with people with SMI who are in correctional settings. These settings are places where care is critical, and we are grateful for your willingness to share the lessons you have learned around providing basic treatment for this population in these places. Let me start by asking Dr. Hall, can you describe a case where your treatment approach yielded a positive outcome and made you actually enjoy correctional practice?
Yes, the treatment approach is, I think, more important than the actual patients because there have been so many over the years. The most important thing, in my opinion, is to not give up on treating these patients' symptoms and to be diligent at making sure that people are not just improved, but are well. And 2 things that are involved with that are continuing to push on and treat people's symptoms, but to consider medications that are not used in community settings as often because they're difficult to manage, like clozapine in particular, but even just lithium is also not used enough in community settings. So I've had, probably 10 patients in the last 6 years whose lives have been completely changed by the treatment of clozapine. One of whom came to us after 4 years in a jail where she was in solitary confinement, unmedicated. She came to us in a very difficult state. And over the course of several months, we got her on a very high dose of clozapine, and she was able to move to a residential setting in our prison. So that was really gratifying.
That's amazing. Dr. Dennis, how about you? Can you describe a case where your treatment approach yielded a positive outcome that made correctional practice rewarding?
One of the things that I really like hearing about is when a colleague calls me and tells me that someone who was in one of the jails that I work at have been started on a long-acting injectable medication, and they're actually following up with treatment. I really think it's important for patients to have a continuity of care. And if you start them out with the best intentions and you start them out with something that's going to be lasting for them, I think that that is definitely beneficial for patients.
That is great. And that is so rewarding when we see, patients really turn around and either just total symptom improvements or not being on that hamster wheel, like you said, which can be so demoralizing for them and for us. So let me stick with you, Dr. Dennis. Can you provide some basic treatment lessons learned in terms of screening or diagnosis or offering treatment for individuals with SMI in correctional settings?
Absolutely. And depending upon which type of setting you're in, when our patients first hit the door, they're going to be either screened by the correctional officer that is there at intake. And oftentimes, if there's a question like, have you ever been on any psychiatric medications, or have you ever seen a psychiatrist or a therapist? If those questions are yes answers, then that typically a prompt a referral to our social workers within the jail setting. And the social workers will do screenings for substance use issues, for suicidality and homicidality. And from that point is when they're either referred to psychiatry to be seen for an evaluation. So it's questions that start at the door. And oftentimes it's easier to get a patient in treatment once those initial basic questions have been asked. Have you been seen before? Have you used any substances? And even have you had any thoughts of suicide, or are you having thoughts to harm others?
Yeah, that's great. Those are some great lessons about early screening. Dr. Hall, what are your thoughts about some basic treatment lessons?
So all of our patients also, I think it's a requirement, are screened for mental health conditions at the door of the prison. And I think the most important thing to remember, in at least in the female incarcerated population in the prison, is that trauma is a huge element of their history. And trauma can look like virtually any other diagnosis, especially if they have also been using substances chronically, which is also very common. So one of the things that we do is educate patients about what their symptoms could be, and that it often just takes time for us to know what their symptoms represent. PTSD is fairly easy to recognize early on, but it can be complicated by post-acute withdrawal symptoms and other comorbid conditions, because many of these patients not only have PTSD and substance use problems, but also major mental illness. So just remembering that things can look like a lot of different things, and to keep an open mind about diagnosis over time.
Yeah, I think that's a really great treatment lesson. And especially since we know that people with serious mental illness are very often victims of violence. And, you know, the confluence of factors that you mentioned are really important to think about. So, Dr. Dennis, what are some strategies that you have used to help maximize quality of care in a correctional setting that might be helpful for others to hear about?
I think one of the biggest is using empathy with patients. In the correctional settings, there's a certain dynamic that goes on. You have the custody side of the house, and you want to make sure that you're fostering a good relationship and treating individuals as patients. And it's a personal pet peeve of mine to not call the people that I'm treating inmates or prisoners. I call them my patients, or I call them by their name. So having that empathy and looking at them as people, as individuals, the same people that I've treated at community hospitals, these are the same patients that come to the jail setting and are in the prison setting. These are patients from our communities. And treating them with empathy, I believe, has been the greatest for them. And it allows us to foster those types of relationships where you can be, where you can really understand what their needs are, because they come from all walks of life, and a lot of patients have different stories. But when you can empathize and really get an understanding of who they are, you can treat them a lot better.
That's really nice. Dr. Hall, what about you? What are some strategies that you've used to maximize quality of care?
So like Dr. Dennis said, working with our correctional colleagues in this setting is extremely important. They have a very different perspective than we do, but they have a very important perspective, which is that they live with our patients much more time than during the day than we do. So to take their perspective into consideration, they are part of the team. I think teamwork in these settings is one of the most important things to increase satisfaction and decrease burnout, because these are very difficult settings to work in. The patients are very complicated. They have long histories, often in the community with mental health problems, also long histories in the correctional carceral settings. They've been in and out of a lot of different institutions. So working together with all of the people who are seeing that patient in our setting is, I think, going to maximize the care that they're going to get. And again, I'm a clozapine fan. I know not everyone is, but to think about clozapine for patients who are not getting better. It's very easy to monitor their white counts because we know if they've gone to get their blood drawn or not. Likewise, lithium can be challenging for patients to take in the community, and that can also be more easily monitored in the correctional setting. So working with the full team of our players and getting all of their perspectives, I think, provides the greatest care for our patients. And we can also, piggybacking on Dr. Dennis's comment, we can also model empathy for these patients. Some of our correctional colleagues don't see them in a compassionate way, at least not initially. And we can help them understand that these are people that you are going to see in the community when they get released. And you want them to be released into the community with the best mental health possible.
Yeah, that's great. So lastly, any advice you have for other providers who would be working with people with SMI in these environments that could help them have a meaningful and positive experience? I'll turn to you, Dr. Dennis.
Yes, I think one great way to really foster a good treatment relationship or making sure that patients get exactly what they need is actually utilizing everyone on the team and ensuring that everyone on the team has input in the care, because we don't want to just make sure we're treating one part of the individual. Patients have multiple medical conditions, so you want to make sure that you're conferring with internal medicine or family practice, whatever providers you have on site, and being that advocate for that patient, being an advocate for treating their bodies holistically, their mind, their bodies, their souls. We want to make sure that we are treating them. So if you need to reach out to the chaplain for the patient, do that. Just tap into all the resources that are available for these patients. Oftentimes, people do come back to jail because they don't have any additional, they don't use the resources that are available for them. So tapping into whatever resources in your facility are available for them, I think that will go a long way.
That's great. I love the idea that you were bringing in even chaplain services to think about holistic treatment. Dr. Hall, any advice you would give for providers working?
Yeah, I concur that using all of our colleagues in the correctional or carceral settings is really critical to providing the best care for our patients. And the great thing about working in these settings is everything is right there. The chaplain is right there. The medical staff is right there. Nursing staff is right there. So you don't have to make an appointment with the doctor that gets rescheduled. It's all available to you if you reach out. And oftentimes medical hasn't been consulted on chronically mentally ill patients, and they don't know how to manage their somatization or other problems that they have that are frustrating for medical staff. So I think we can really support our medical and nursing colleagues by educating them about how the different ways that mental illness symptoms can present. The most important thing, I think, though, is making sure that the provider is taking good care of him or herself. These are very, very stressful environments to work in, and there's so much work. You don't have time to sit down and have a cup of coffee with your colleague and talk about a difficult case. It's just there's never time to do that. So we have actually developed a support call once a week with other carceral psychiatrists who can call in and talk about difficult cases they're having, ethical conundra, self-care problems. How do I manage my stress headaches? I get one every day before I go to prison. Making sure that people take good care of, the providers are taking good care of themselves, finding support, finding peer supervision, finding other people who work in these settings to talk to about the difficulties or the challenges or the rewards. Because people who don't work in carceral environments really don't know what they're like, which is why we really encourage people to at least do a rotation in a jail or a prison, or if you can't do that, if that's not available, to take a site visit to just see what it's like to be inside a jail or a prison. It's really enlightening, and there's really no other way to know what it's like.
Yeah, those are great pieces of advice. Well, I really appreciate both of you sharing these lessons that you've learned with your experience around the care and treatment of individuals with SMI in correctional facilities. Your strategies and recommendations that you highlighted, bringing in holistic care, being trauma informed, thinking about trauma as a major factor, taking care of oneself and leaning on a team approach, and using medications and treatment approaches for people with SMI that have a real evidence base and can help people have symptom improvement and quality of life improvement as well. Really give great guidance to learners who might be interested in working in these environments and who are already working in them. So thank you so much for your wisdom, your expertise, and your passion for this type of work.